Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. Doc, on today's episode, we want to talk about something that you're starting to see a lot more about on TV, and it's this thing called Restless Leg Syndrome. And I wanted to just kind of start off, because in my research for the show, we came across a Dr. Donald Free, who made this statement. And he said, the most effective treatment we have found to relieve the symptoms of RLS, or Restless Leg Syndrome, is proper spinal manipulation. And really that Restless Leg Syndrome is nothing more than a chiropractic deficiency. What can you tell us about that?
I would kind of agree with that. Restless Leg Syndrome, you can have pain, pins and needles, numbness, or burning. Lower extremity, upper extremity. If it's coming from the lower extremity, it's usually a pinched nerve, Jerry. It's coming from the lumbar spine, your hips, your pelvis, your low back's out of alignment. It's basically, just to keep it simple, it's hard bone out of position pressing on soft nerve. So if we call that a subluxation, it's a misaligned vertebrae, and that can cause pain, pins and needles, numbness, or burning the lower extremity if it's the low back, the upper extremity if it's coming from the neck. So look at the neck, look at the low back, adjust it, take pressure off the nerve. 99 times out of 100, if you take pressure off the nerve, you're treating the symptom, you're treating the cause of why they have the symptom.
I love the term that he used of this chiropractic deficiency, because really we always talk about the chiropractic connection, and you always talk about how we don't have an aspirin deficiency or a Tums deficiency. But this thing called a chiropractic deficiency,
that's something new,
is a whole different ballgame, and I really think people need to grasp that concept.
It's like something that they have. If you have a chiropractic deficiency, you wouldn't know until a chiropractor tells you need chiropractic. I'll tell you why, Jerry. See, 90% of your nervous system is silent, meaning 90% of your nervous system is functioning and performance. It goes to your cells, organs, and muscles. Only 10% of your nervous system is actually causing pain. Okay? Now, if you're having pain, if you're having pins and needles, numbness, or burning, that means you have a pinched nerve, and then you know yourself to get chiropractic. You can take a drug. What's the drug for restless leg syndrome? Does anybody know?
Yeah.
Quinine or something.
Right.
Okay, no little chiropractor comes out of the drug and adjusts your spine. So it's funny, but it's true. I mean, that's the only way it's going to work. You have to make positive rehabilitative changes in your neck and in your back and in your spine to get to the root cause of why you have the symptom. See, the symptom, Jerry, to me, is a red light on the dashboard. If you had a red light on your Chevy, would you pull into the Exxon station, or would you cover it over with a black magic marker? What would you do?
Yeah. Well, I mean, I definitely want to get it checked out because I try to take care of my vehicles.
Well, here's your vehicle.
Yeah.
Your body's your vehicle. It gets you from point A to point B. So your body's your livelihood, right?
Yeah.
So no body, no work, no money, no food, no eat, no live. You're making life and death decisions, Jerry.
I think when we talked about this whole thing about getting medication for problems and treating, because I see this all the time.
Yeah.
People, they'll go to their medical doctor, they'll get a medication, maybe they'll, it's kind of mask the pain for a little bit, short-lived, and it's just this cycle. They constantly are going back. It never gets better.
Because there's side effects. Then they're having side effects from the original drugs, so then you're taking 3 drugs for the side effects. So you're like Harvey, who came in the office, says, how are you feeling? He's taking 30 different drugs, but he feels fine.
Yeah.
Why? Because he's numb.
Right.
He doesn't feel anything.
Yeah, and I think we have to get away in the medical profession when we're looking at our health care of treating just the sign or the symptom, and like you always say, get back to really what's the root cause.
That's
you could have this restless leg syndrome that is the side effect of this problem here in your back.
That's true. See, the diagnosis doesn't tell you why you have the problem. It's giving you a syndrome, but it doesn't tell you what's behind it. That's what we do. We look behind the diagnosis and find out why you have the disease. Why do you have the syndrome? Why do you have the symptom? We're kind of like doctors of why.
Yeah. And I mean, think about this also as you're watching this. When you go to the doctor and they'll ask, well, where's your problem? Oh, it's I got restless leg syndrome, or I've got a problem at my ankle. What do? They go right to that area. They focus in right there. Maybe they give you a medication, give you an injection, whatever.
Of course.
They never really look at the overall body. I don't know if I've ever been to a medical doctor that has really given me that thorough. They always go right for the area of the problem.
Well, they're missing the boat, in my opinion.
Yeah.
Because just because you have a pain doesn't mean that's where the problem is. Okay? Like if you have a problem with your tires, maybe the problem's not with your tires. You need a front end alignment.
Right.
So that's what we do. The front end alignment is your hips, pelvis, low back.
Yeah. I think this, and we talk about this a lot, but this car example, I really think is a great way to simply understand your body.
You're right.
You know, and you know, like you had said, if that tire's wearing out wrong, it's not a problem with the tire. It might be a tie rod, or you know, something's out of alignment that needs to be fixed. And you're not going to see that just change the tire. It's going to fix it for a very short period of time.
And you need a new tire.
It's going to be right back again. Okay, it's that vicious cycle that a lot of you are in, unfortunately, with these problems. Whether it's restless leg syndrome or any other problem that you're having, I think if you look back at your history, they're going to find that they're in this cycle.
Even knee prosthesis, my understanding, Joe, you get a knee prosthesis 5-10 years, you need another one.
Yeah.
Because then you get I don't need a knee prosthesis, I'm 58. Okay, I've been getting chiropractic for 39 years. So if somebody needs a knee prosthesis, why do they need a knee prosthesis? Find out why. I understand the baby boomers in the last 10 years, it's quadrupled the knee prosthesis.
Oh, absolutely.
Okay, which is people around my age. Why are they needing a knee prosthesis? I don't need a knee prosthesis. I've been getting adjusted for 39 years.
Yeah. Yeah, I mean, it always gets back to practicing preventative medicine. It's never, you know, too early to get started, and it's also never too late to get started.
Sure.
You want to, just getting started is the key. You know, if you just start making some simple changes, you know, it can have an impact on your body. Maybe not as much as it could have if you started earlier, but it will have an impact.
Where there's life, there's hope. I treated women yesterday, 86. I treat women 95. Where there's life, there's hope. Age has nothing to do with it. Anybody can be helped.
Yeah, I think we need to throw out the number system, you know, and just saying, oh, I'm 60 now. Oh, I think, you know, life is over.
It's how you feel.
Right,
it's how you feel. You could feel 60 or you could feel 18.
Yeah. And we definitely have to stop using this. I'm just getting old. That's why I feel like this. There doesn't have to be that way. We've been brainwashed to think that, but it's not that way. And you know, one of the things is we talk about it in concluding all of our videos that we really stress, whether it's restless leg syndrome or any of the other problems that you may have going on. Dr. Goldberg offers a new patient free evaluation for you to come down and just talk with them and experience what chiropractic can do. I know you've had some patients come in for things that they never thought chiropractic care could treat, but they saw one of our videos, they saw one of the blog posts, and they said, I never even thought about that, and they came down and had great results.
Well, that's the side effects of chiropractic. The side effects of chiropractic is you get well.
Yeah. It's a new concept in healthcare. So, but we really encourage you to pick up the phone, visit the website, come down and experience Wellness Associates for yourself and see what Dr. Goldberg and his staff can do for you. So with that, we just really appreciate you spending time with us. We hope every week you check out this site and check out our videos on upcoming topics. We've got some great things coming up and planned for you this month, and we just really enjoy bringing it to you. And our goal, as always, is just to help better educate the consumer out there on, you know, how to take care of their health, how to cut down healthcare costs. We've got, you know, the only solution out there, and that is to really get back to the root cause of things. Allow your body to do what it does best, and you'll be amazed how much better you're going to feel. So thank you very much for checking out our show today. We look forward to seeing you on the next episode. So have a great day, and we'll see you soon.